Good morning, listeners, and welcome to another show of Fourth Trimester Voices. So today we have Hannah Maurer, the founder of Haven Miscarriage Clinic. Hannah is a certified nurse midwife. She has a lot of experience in both childbirth and pregnancy loss care. Hannah started the Haven Miscarriage Clinic, which is the first specialty clinic in the U.S. dedicated to early pregnancy loss, aiming to provide holistic care by focusing on both the physical and emotional recovery of patients. I thought it was super important to have Hannah on this show today. We talk a lot about postpartum, we talk a lot about pregnancy and childbirth, but really we don't address what loss and what impact that has on moms, especially in the postpartum period, because they're also going through that, especially depending on how many weeks they miscarried. And so, Hannah, thank you so much for agreeing to come on the show. I'm so
So
excited to
welcome.
open this conversation.
I'm so excited to be here.
Oh my goodness. So tell us a little bit about your journey. How did you decide to do this? It
Mm,
obviously is a calling because,
absolutely.
I can't imagine people waking up and thinking about this unless
hmm
you've been through an experience like this. So tell me about your
Sure.
journey and why you chose to open Haven.
Yeah, no, you're spot on. It's such a calling. I think, especially being in the birth world, the really attractive part is catching babies and posing for pictures. And
Hmm.
you get this birth high after you go through these experiences with ladies. But really, over the last 10 years, I noticed gaps in pregnancy loss care and the options that we're offering these families, the care, the mental health gaps, and then also going through my own personal journey with pregnancy loss. So I was a midwife at the time, and my pregnancy loss journey was so complicated. And even knowing what I know as a midwife, I felt this fog when you're going through it. And looking back, it's like I wish I had kind of advocated for myself or went through
Mm.
all the options in my head. But really, when you are struck with grief, it just changes the mental game. So my own pregnancy loss, I lost at 10 weeks. I was like, you know what? It is what it is. I just want to do side tech. So I went through the side tech process, went straight back to work, which knowing what I know now is probably not the
Hmm.
best thing, and exposing myself to triggers. And I vividly remember two moms who had the same due date as me. And they came in, and I'm like, yay, October 10th. That's the easiest 10/10 to remember. But that was also my due date with my baby. And I thought I was okay then. Obviously, I wasn't. So went back to work and then had retained products, ended up having an infection, got a DNC in the emergency setting, and had an ultrasound by myself alone, tears flowing down. You know how exquisitely tender that is.
Mm.
And I thought it was done at that point, and it wasn't. And so my HCGs weren't dropping. They thought I had an AVM, which is arteriovenous malformation, which you know what is.
Hmm.
And so through a series of tests and CT scans and interventional radiologists, come to find out it just was more retained products. I had a second DNC, and the whole experience was the span of 2.5, 3 months, which actually
Mm.
was pretty quick. Consider I was working at that hospital, they got me in really quick. But as I was grieving, I was like, there's got to be a better way. And is there a better way? So that was kind of the start of this passion. And
Mm.
then I've had kids since then and gone back to more traditional midwifery and just still seeing the same themes.
Mm.
It finally was time to make a change and make a difference.
Yeah, I think your story resonates with a lot of women. Before, I also suffered a miscarriage, as you know. I
Mhm.
suffered two miscarriages. And before then, I was just an emergency room doctor taking care of patients in the emergency
Yeah.
room who have had miscarriages. And going back, now and seeing how I provided care before having a miscarriage, I wish I could take that back because
hmm
when you're in it, you're right. You're no longer a provider. You're a mom. You're
hmm
a woman. You're an emotional being. And so when you talk about that trauma, it sticks, right? And you said something, you had to go right back to work. And there's something, I did the same thing. I remember
Hmm.
my first miscarriage. I miscarried on a Friday, ended up in the hospital on a Saturday. My boss actually took care of me, and my boss was like, I'll see you on Monday. And I was like, I didn't advocate for myself. And that
Yeah,
entire week, I was in pain. Just talk about the trauma and going through that alone, and just wishing that things would be different, that care would
right,
be different. And so I can't imagine something like Haven being around during that time. And so I could see I'm seeing your journey and I'm seeing the need, right? And
right,
so there has to be a different way to do things because the way we're doing it right now and how women are going through this process, it can't be the case. We can't
right,
do it, you
right.
know.
And we've seen the effects of that long term. We've seen it in our own mothers and aunts
Mm,
and not talking about it. And grief in and of itself is so isolating. And just to wrap, I know we're going to talk about postpartum in just a second,
yeah.
but we don't have a physical baby to
Hmm.
get that empathy of, oh my gosh, can I hold the door open for you? Or can I bring a meal? It's
Mm,
just not as obvious. It's such a hidden thing to begin with. And then the fact that we don't have a baby to show for it on top of that makes it even more isolating. And even though it's not something that we cause, we still feel this like shame of the
mm.
grieving process or the depression or anxiety that we're feeling.
Absolutely. And I don't think a lot of women really talk about it. And I don't know why that is, right? And I know there's a lot of stigma, there's just maybe the fear of judgment, but I'm kind of share a little bit about why you think women don't share their stories with each other.
Hmm. Hmm. I think to your point, there's a lot of different factors that go into it. A lot of it's learned behavior. I mean, and having young children right now, I think about what I tell them and what they perceive as
Mm,
normal, right? Even a conversation about periods, right? Like think back about how you first learned about starting your period. Did you already know, that like this is what happened? Did your mom
mm,
share from a
yeah.
young age and show you putting her tampon in? And so when it came, you're like, oh, I already know what this is, or was it like a big discussion? And so I think about even just with my children, what am I normalizing for them? And then what is the language around that? It used to be
Mm,
generations back. We called it Aunt Flo coming to
hmm.
visit. We called postpartum depression. She had a mental break and negative
Mm,
language around it. And so that perpetuated this box that we created around ourselves of it's negative, even though like something like starting your period or menstruating is normal. We know that's normal, but there's this kind of negativity around it. And I think it's really similar with loss. On top of that, another layer is cultural stigma. I mean, all around the world, I've heard different perceptions. One of my little girl's friend is her mom's Kenyan. And I said, I think I know
mhm.
the answer to this, but go ahead and tell me. And I mean, she validated what I already knew is generations back believed that there was some sort of sin that
Mhm.
happened and God is punishing you for that, even either
Mhm.
sleeping around or whatever it may be. It's a punishment for something that you did. And
Mhm.
so that's a huge burden to carry. That
Mhm.
thinking back, okay, what did I do that this would have happened? And that's just not factually based. And
Mhm.
so there's so many dimensions to why we hide it. Another thing is just the grieving process. Some people aren't ready to talk about it, and that's okay. Dissociation is really common when you've lost someone and really separating yourself from it and then coming back. So, as much as I want people to get help right away and therapy right away, sometimes we don't want to face it and we do want to kind of create this bubble for a little bit.
Mhm.
And so whether it's how you're feeling, what the narrative of loss was that you were exposed to, whether it's cultural, there's a lot of work to be done.
Absolutely. Absolutely. Why is it important to talk about pregnancy loss when you're talking about postpartum?
Yeah, yeah. So I love connecting the two because we think
Mhm.
postpartum, oh my gosh, sleepless nights, you're up nursing the
Mhm.
baby. We focus on postpartum depression, or at least for me as a midwife, I really focus on that. We don't think about the lost mom as much.
Mhm.
And similar to what I said earlier, we don't have that physical baby
Mm-hmm.
We also, this is a whole other complex thing that we do, is it depends on the gestation, right? We, in a
Mm,
sense, level, which is harder, a 40-week loss versus a 4-week loss. And they're
mm,
just different. The reality is they're different. When it's a little bit earlier, sometimes you're grieving what you thought was going to be your family life and the picture of that. You're grieving an expectation for what that baby
mm,
would have been in your life. And then 40 weeks is totally different for a different reason. You're going through the whole labor process, and equally you have hormonal shifts with both, but you do enter a postpartum period in both situations. It's birth nonetheless in
mm,
both situations. There's hormonal changes, and you're at very, very high risk for postpartum issues like postpartum depression. And really, the breakdown of the word post just means after,
mm.
partum is birth. So any time after birth within that first year is considered postpartum. And
Absolutely.
with a group like Lost Moms, with our risk being even higher for having mental health, it's so important that we put them in that category of high risk. So as providers, we can be on the lookout and do screening. And then also we're more inclusive with the kind of
Mm,
care that we give. And I've had so many lost moms who are like, that's so validating to hear that, because that's what it felt. It felt
mm,
like postpartum depression I had after my first child, or it really felt like it was triggered from the loss, even though my
mm,
doctor told me it's not postpartum depression or it's
mm.
not postpartum. And so there's a little bit of confusion with the language. But I really feel like just the word postpartum needs to be inclusive of people after a pregnancy loss, no matter what gestation.
Mm. And I think that's important too, even thinking about the physical changes that mom is going. So you think about carrying a baby full term and then, suffering a stillbirth, right? Your breasts
Mm-hmm.
have still changed, right?
Mm-hmm.
You're still going through the vaginal bleeding. You're still going through the healing of your C-section wound if you had a
Right.
C-section.
Right.
You still have the hormonal shifts that what I shouldn't say normal, but that moms also have gone through
Sure.
who have carried their babies full term. And so you've gone through the physical changes, you've gone through the mental changes, the emotional changes. And so, therefore, you are postpartum.
Mm-hmm.
And so,
Mm-hmm.
therefore, you deserve care and you deserve a higher level of care. You deserve more attention. And so, it is important to be inclusive and have these moms in the conversation. And I love that you are starting and you continue to have these conversations for
Mm-hmm.
sure.
Mm-hmm. Yeah. And one of the other things, even with postpartum, I mean, I go through my checklist of the whole 6 week thing is a really silly thing anyway. It's like we just have
Hmm.
created the 6 week is the magic number. As I go through the checklist of all the things that I talk about in that 6 weeks, like, are we sleeping? I'm a huge like
Mm.
sleep, 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 sleep person because it's so restorative. It's so healing. It helps our mental health so much. Do we talk about that with someone who's had a loss? Another thing is return of menses, having our period come back.
Hmm.
Are you ready to get pregnant again? Do you know that you can get pregnant before you have your first period? For a lost mom, that's really important. We're
Mm.
grieving the loss of one baby, and maybe we need a few months, maybe not. Is it safe to get pregnant right away? But those are some of the things that I talk about for postpartum visits. And it's just not done in a loss care visit like it should be. We really need to be considering all of those things. If they want birth
Mm.
control, what are the implications of hormonal versus not? And what does that look like for them? And so
Yeah.
really integrating all of those into the dialogue that we have after loss, I think would be so beneficial to lost
Absolutely.
moms.
And I also think you talk about 6 weeks, most women are going back to their OBGYN or their provider at 6 weeks. And so I don't think that's really appropriate for most moms. And now thinking about a mom who has suffered a loss, that time frame does not make sense for me. And
Mm-mm,
so how should we be doing it? How should the United States be doing this? Because seeing a mom who's literally suffered an immense amount of trauma at the 6 week visit to just check in seems
mm-hmm.
highly inappropriate.
Yeah, yeah. No, I agree. And I've practiced in different states. I've done it a little bit different every time. When I
Mm.
was in Houston, I loved our postpartum schedule. We did 1 week, 2 weeks, 4 weeks, 6 weeks.
Great.
And we did couplet care with mom and baby at the visit too. And I was like, it needs to be weekly if
Hmm.
you're really going to catch, especially mental health. I can't tell you how many
Hmm.
people We've gotten a phone call from a pediatrician that they're worried about the mom, or the 6 week visit is almost too late if there is any
Mm,
mental health or underlying changes going on. And we know postpartum psychosis happens way sooner than 6 weeks.
absolutely.
So
Mhm.
I am a proponent. I love telehealth. I don't like getting moms out of their house, which is why I love what you do. Not to put a plug for you, but I don't like getting them out of their PJs. Stay in
Mhm.
your PJs, get as much rest, sleep when your baby sleeps. I'll just call you and at least check in with you and see how things are going because I agree. So I like weekly touch bases at least. And then it also opens the door. If something comes up that they feel is abnormal, having some accessibility, a text
Mm,
message, or if we need to get you in sooner, no problem. I think gone are the days where people have to wait 5 days to hear back from their provider. I think it's ridiculous. And so
exactly.
much can happen in 5 days. No wonder we have poorer outcomes, right? If an
Mm,
infection is brewing on a Friday and we don't wait, and we wait and don't see them until Monday or Tuesday, like that could be septic at that point. And so I think having accessibility to your provider, having weekly touch bases via telehealth, and
mm,
then really depending on the type of loss that has happened. If we're waiting for things to happen on their own, I think just checking in, and then sometimes we're trending HCGs down. Sometimes they're doing tests at home. So it looks different.
mm,
I think that's another key is we're not robots. So we shouldn't
mm.
have a robotic schedule. It might be that you need more frequent check-ins than someone else. And I think there should be some wiggle room for individualized, personalized care, depending on what that looks like. Are you more high risk? Do
Absolutely.
you have a history of postpartum depression, postpartum psychosis, OCD, anxiety? Then I'm going to be at least wanting to keep a little bit closer tabs on you.
Absolutely. Now, I know Haven Clinic is not up yet,
Yes.
but just like, help us visualize what it's going to
Mm.
be like. Tell us a little bit about the experience that moms are going to have when they walk through the
Mhm.
door. Help us dream a little bit.
Yes, that is all I've been doing for a long time. No, it's really, really exciting. So we're working on actually creating the physical space, and we're getting a lot of people who are coming from personal experiences. The design team we're working with, she's had two losses herself as well.
Mm,
And so all of the details of even the ceiling, people remember what's on the ceiling when they have a loss. So creating privacy. So there's really not going to be even a waiting room where you could see someone else. You're going straight back to a
mm,
room. Everyone comes to you. The lab comes to you. The ultrasound comes to you. If we're doing a procedure, that's very private as well. So we like to say kind of contactless, like
hmm
back to COVID days, right? But that privacy and really allowing that space, and then emphasizing partners too, and who's going to be there supporting you, having a hospitality area where you can obviously get water and all this stuff, but also like education and support for the support people, and
mm,
creating what we call a cushion around that family. So everyone leaves with a mental health referral in their pocket, at least just as a consultation, because what I found is people don't reach out, especially in that early
mm,
time. But if they already have that connection, they're more likely to reach out if they know they've already talked to someone and have their phone number. And then having all of the comfort measures. So I think about it in terms of our senses, right? So, like, what am I hearing when I walk into the room? Am I
mm.
hearing a baby crying in the next room? That's a no. That's triggering. Like when we go to an
Mm,
OB office, we see pregnant bellies, we hear the postpartum baby in the next room. And that's
mm,
absolutely the opposite of what we're trying to do here. So we're not having other babies, we're not having pregnant bellies, there's not going to be kids who are in the
mm,
office listening to like not triggering music either,
mm,
like just
mm,
melodies, because even words can be really triggering. And then, like, what are we feeling? Having blankets available for people and having
mm,
comfortable seating or a recliner chair instead of a really sterile, cold, fluorescent light ceiling, like dim
mm,
lighting too. So, visuals as well, like not triggering pictures. So, we're thinking of all of the senses when someone comes in to maximize that like cushion of support, and then all the referrals too. So, whether it's genetic testing, we're going to like cover that. You're going to
mm,
know all of your options and be given those options. A lot of funeral homes will do free cremation or free service if you want, and giving those options, because after talking to family after family, they wish they had that. They wish they had footprints. They wish they had
Mm,
something to take home. And so being able to provide all of the options and then still providing evidence-based holistic care, really all of the aspects of care from the moment you enter in and you check in on your phone, you come straight back to your room, and then you're also funneled out in a similar manner. And it's a place that you feel safe and supported and like they
mm.
understand too.
Wow.
So lots of really cool things on the horizon.
Mm,
There's people miscarrying today,
mm.
and we're doing it for you, but I wish I was open yesterday. And so
Yeah.
that's never lost to me the need today for a place like this, but we also are so intentional with how we're doing this that we want to do it right.
Absolutely. Just thinking back at being in an emergency room with first loss and going through the bleeding process,
Mhm.
going through the cleaning yourself up, the humiliation of being in a waiting room in a gown, the follow-up after that. There's just those images live
Mhm.
in my brain.
Yeah.
And so knowing that you're being intentional about the space,
Hmm.
intentional about reducing triggers, intentional
Yeah.
about bringing personalized care for moms is important. And I don't think some people just do understand, right? They empathize, but I feel like having gone through it, I understand the crucial nature of what you're
Yeah.
doing. I understand that this must happen. And so I fully
Yeah.
support you and fully support what you're doing because there's a place for it. And
Yeah.
until you go through a loss yourself, you don't even understand the gravity of the impact it has on your life and the people around you. And so
Right. Yeah.
super exciting stuff you're doing.
Yeah. Thank you. And we feel the support. And unfortunately, it's
Mhm.
not until years later. Some people think they're fine. And
Mm,
then years later, they're processing through maybe something else and they're uncovering this grief. And so there's some people
mm,
who are like, oh, I miscarried. I thought it was fine.
mm,
And really you ended up not.
mm,
And so yeah, it's a unique space, but it is
mm.
very, very needed.
Absolutely. What advice would you give a mom today who is grieving a loss or going through a miscarriage?
Hmm. Give yourself grace and allow yourself the space to grieve how you're going to grieve. It's not going to be how your mom grieves. It's not going
Mm,
to be how your friend grieved. So a lot of people send condolences to make themselves feel better and,
mm,
share their journey because it's a way that they can help, but it's going to be unique for you. And however you do that is absolutely okay.
mm,
Self-care is it doesn't feel like it's important in the moment. And I will be the first to say I was terrible at it. I went back to taking call at
mm,
night and not sleeping, and I paid for it. My mental health paid for it. I'm very open about how I was on medication for 2 years to help support the anxiety that turned into OCD too. But as I've even now processed, there's so much that I could have done to have prevented that, like just getting into a REM cycle to
mm,
help heal a little bit. So journaling is really important too.
mm,
Taking just pauses, be outside in nature for a little bit, take care of yourself as much as possible, and then the most support around you. Have people making meals for you, have people taking dogs out, cleaning your house if you
mm,
can, getting a therapist on board, someone to talk through. It doesn't mean you're going to have to start on medication, but at least having those resources available to you because it is normal when you've had a loss to grief. It is normal. It's
absolutely.
not something that you're weird or you're psycho for. It's normal.
Mm,
And so just
absolutely.
to assure that it's normal and give yourself some space and some time.
Mm, absolutely. Before we close, I do have a
Mhm.
question.
Yeah.
And honestly, it's just a question. I think it's more for my curiosity too. But with the climate of everything that's happening within our
Mm.
state of Georgia and women's rights and legislation, how do you navigate the space knowing that you're providing life-saving care for moms and that people may not understand the
Hmm.
gravity of what you're
Yeah.
doing? How do you navigate that space with just strength, commitment, and just fortitude?
Yeah. So this has been a very kind a common conversation that we've been having. So first and foremost, get a good attorney.
Good.
So we do have reproductive rights attorneys that we've been in conversation with because it is a little bit more of a tougher climate per se
Yeah.
for abortion care here. People don't
Yeah.
realize, and you might have seen in your chart, like spontaneous abortion.
Yeah.
The care is pretty much the same. It's all
Mm.
abortion care. Even though it might be an elective termination versus a miscarriage, it very much connects and coincides. Even though there's not a heartbeat and there is a heartbeat, the management is very similar. So what we've anticipated is being under the microscope with the kind of care that
Mm-hmm.
we give. So there's procedures in place for that. Like everyone has to have an ultrasound done in our office so that we can confirm that there's a non-viable fetus or non-viable baby, and just having policies and procedures in
Yeah.
place. There's nothing that we're doing that's illegal from a state
Absolutely.
perspective, but because there's a lot of crossover, just really making sure that we have all of those layers
Good.
to protect ourselves because of where we're at in Georgia. And it could change.
Yeah.
We're close to November, right? So who knows? But no matter what, we're still going to be giving the care that we're going to be giving to our families that come in. And we
Good.
feel so passionate about giving them the safest options and the most options that are affordable and accessible. And so part of that is navigating this climate right now.
Mm. Good.
I'm
Well,
so glad you asked that though, because that's a question a lot of people don't ask. And it's
hmm
really, really, it's a close cousin of what we're doing.
Yeah. Yeah, I think it's super important because like just seeking out care and knowing that they like moms can go to places like this and they won't be ostracized and politics won't come in, that people are
Right,
treating them in a humanistic way, right?
right.
Because there's a lot of fear that moms have. And
Mhm.
even if they do miscarry, they may be at home and suffer the complications that come with
Right.
it because they don't want to seek out the care. So I
Yeah,
did want to make sure that I asked that question because it's just you can't talk about this without talking about that there's other people out there who don't really
absolutely agree.
understand the gravity of this.
Yep,
So,
absolutely.
yeah.
Absolutely.
But thank you so much for joining us today on Fourth Trimester Voices. It's been an amazing talk. I am rooting for you. I'm rooting for this clinic. I tell everybody about it and just
Oh,
so excited for you and what you're doing.
thank you so much. And I'm so appreciative of what you're doing. I absolutely love it and champion you in any way I can.
Thank you. Thanks, Hannah.
You're so welcome. Bye.
If you live in the Atlanta, Georgia area, I want you to consider working with EM Care to You. And this is my concierge medical company, and we offer comprehensive care for mothers postpartum. I started the company because I saw a need. I was taking care of so many postpartum moms that had a need, and I wanted to provide a solution for their problem. So at EM Care to You, we provide access to in-home lactation support, pelvic floor physical therapy, mental health support, and more. You can learn more about this at emcaretouYou.com. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.